Hello, my name's Jerome, and this is my audience. So I'm going to be talking about the medical field and the process of getting through it, um, and what you can achieve after. And I'm going to start with talking about David Livingstone. David Livingstone um, mapped out a lot of unexplored areas of Africa as a practicing doctor, and because of it, he brought the gospel to a lot of unreached tribes and people in Africa. Um, so, even if you don't want to be a doctor or a medical professional, we all need doctors and want to know that they are well trained and qualified to care for us. Um, so, my brother went through open heart surgery, and because of this, we studied a lot of doctors to see what the best place to get the surgery would be. Um, and now I want to become a doctor myself and have therefore done professional research, personal research. Um, the amount of time in schooling that is needed to get through the medical field is a bit lengthy, and depending on the degree you're looking at, it can take several years more than just a bachelor's. But this does not mean that it is a waste of time. The purpose of the medical field is to help care for those of who have medical problems and needs. By doing this, you're not only serving others, but you are given the opportunity to be an example in hardships for those um, in hardships, like written in 1 Timothy 4. Um, which that brings me to my next point, which because medicine is such a broad topic, a lot of research is needed to put into it. And because of that, a lot of technology has uh, surfaced over the years to help with medical care. And because technology is advancing, treatments and cures are being researched by places like Stanford, who boasts of advancements from their research by Nobel Prize winners to undergraduates. Stanford and Harvard University medical schools who are striving to make advancements in the world of healthcare. For instance, in the field of cardiothoracics, there are places like Cleveland Clinic and Shands Hospital. Research and teachings, for instance, pathway clusters. Headache study done at leading medical universities and sites, Ohio State Med Center, Michigan Headache and Neurological Institute, New England Regional Healthcare Center, Mayo Clinic, and 12 other leading institutions. Dr. Beaver in University of Florida Shands Hospital. Um, Dr. Beaver has over 60 publications, and his research focuses on making cardiac and aortic surgery safer through manually invasive technology and improving post priatic management. He is an active clinical investigator with multiple clinical trials evaluating kidney protection strategies, stent grafting for thoracic aneurysms, and the principal investigator in the NIH clinical trial study, invasive surgery for article, art, or arterial fibrillations. Um, some advancements in medical technology of today include moderating blood of glucose with no needles for diabetic patients, remote heart valve work. In fact, today's technology almost seems like science fiction. For example, there are robotics in medicine, remote monitoring of pacemaking makers, virtual doctors, and much more. Which brings me to my next point, which the medical field is a very broad term. There are many different careers associated with medicine, and each one serves a different and important purpose. For uh, dermatologist skin doctors, from dermatologist skin doctors, uh, pediatrists, foot doctors, oncologists, cancer doctors, and family practitioners. When someone says medical field, you probably think of your family doctor or maybe your child's ear, nose, and throat doctor. But there are other kinds of specialists in the world of healthcare. Like pharmacist, your local pharmacist um, has had a lot of training in order to dispense your meds. Mental health plays a big factor in the world today, with more than 200 classified forms of mental illness. And this brings me to my final point. Becoming a doctor could open up doors for helping people spreading the gospel, with many struggles that may be caused because of medical problems in a patient's life. A person of the field may begin to understand that what Jesus meant in Mark 2:17, when he said, "It is not the healthy who need a doctor, but the sick." Opportunities for missions um, could be something like vacationing in a mini mission, which you would use your vacation um, days to go on a mission to help those in need. The long-term missions, like at my church, there's a woman ministering in Africa to the nomads, a previously unreached group. The only way to be accepted with them is to be a health professional, so being a doctor would open the door. Opportunities for missions at home could be like, imagine being a middle class white doctor chasing a homeless African American man in order to help them. Yeah, that is exactly what Dr. David Hillfaker did. This brings me to my conclusion. The medical field is indeed broad. For me, as a prospective medical student, the information about the career is important to consider. There are so many helpful things. Um, do I want to be a family physician? Maybe the local community, as well as maybe helping the local community, as well as giving my general opportunity to help the medical mission. Or do I want to be a specialist like the doctor who helped my brother? There's mental health, there's surgery, and there's anesthetics, and there's research. The field is extremely broad. So no matter what field of medicine there is, great opportunity to serve the world, just as Dr. Hillfaker has. The Lord calls all believers to try to reach the world, like it is written in Matthew 28:19 and 20. If a person, whether it be myself or you, pursues medicine, besides all the hard work and study and research involved, there is great opportunity for the healthcare professionals to make an impact on the world. Okay, so once again, this is my audience, and I am Jerome.